Tonight, before you pull the covers and settle into the same position you've slept in for the last 30 years, I need you to stop. Because the side of your body you sleep on is not neutral. It is not a preference. It is a physiological decision that directly affects the pressure inside your carotid arteries, the drainage of your brain, and your risk of waking up, or not waking up the same person you were when you went to bed. If you are over 60, this is not a precaution. This is urgent. My name is Dr. Elena Marsh. I spent more than 2 decades in clinical cardiology and preventive medicine, and I have reviewed the sleep positioning data longer than most physicians have even acknowledged it exists. What I'm going to tell you today is not fringe. It is not alternative. It is published, peer-reviewed science that your last appointment simply didn't have time to cover. A landmark study published in the Journal of Stroke and Cerebrovascular Diseases identified a direct correlation between habitual right-side sleep positioning and increased cerebrovascular resistance in adults over 55. The mechanism is specific, the risk is measurable, and the solution costs you absolutely nothing. Before we go further, quick question: which side do you naturally sleep on most nights? Type left, right, or back in the comments right now. I read every single one, and your answer is going to matter as we move through this. Let me start with what's actually happening inside your body the moment you close your eyes. Most people think of sleep as the body shutting down. It isn't. Sleep is when your cardiovascular system performs some of its most critical maintenance work. Your heart rate drops, your blood pressure follows, and your brain, which represents only 2% of your body weight but consumes 20% of your blood supply, begins its own internal cleaning process called the glymphatic system. The glymphatic system is your brain's waste removal network. It flushes out metabolic byproducts that accumulate during the day, including beta amyloid and tau proteins, the same compounds that, when they build up, are associated with cognitive decline and neurodegenerative disease. This system operates almost exclusively during sleep. And here is the part that most people, including most physicians outside of neurology, have never been told. The glymphatic system does not work equally in every sleep position. Research published in the Journal of Neuroscience demonstrated that lateral sleep positioning, sleeping on your side, dramatically increases glymphatic efficiency compared to sleeping on your back or your stomach. The brain's interstitial channels open more fully. Cerebrospinal fluid moves more freely. Waste clearance accelerates. But here is where the data splits, and why which side you sleep on is not a minor detail. Your cardiovascular anatomy is not symmetrical. The position of your heart, the angle of your aorta, the course of your carotid arteries, the geometry of your jugular venous drainage, none of it is mirrored equally on the left and the right. And when you place your body in a fixed horizontal position for 6, 7, or 8 hours, you are not simply resting. You are loading one side of that asymmetrical system with gravity, sustained pressure, and altered blood flow every single night. The question is, which side is protecting your heart and your brain? And which side is working against them? Stay with me, because what I'm about to show you changes how you will think about every night of sleep you have left. Let's talk about your heart first, because its position inside your chest is the first reason this matters. Your heart sits slightly left of center, not dramatically, but enough that when you lie on your left side, your heart is essentially suspended in a more natural, less mechanically compressed position. The pericardium, the sac surrounding your heart, experiences less positional tension. The electrical pathways that govern your heart's rhythm are less disrupted by gravitational pressure on surrounding tissue. When you lie on your right side, the opposite happens. The heart shifts. It rotates subtly against the mediastinal tissue. For a young, healthy heart, this is not a significant burden. But for a heart over 60, A heart that may carry decades of subclinical inflammation, arterial stiffness, or even undiagnosed atrial fibrillation. That nightly positional shift is not trivial. It is a sustained mechanical stress applied for hours, repeated every night, 365 nights a year. A study published in The Lancet found that patients with pre-existing heart failure who slept on their right side reported significantly worse cardiac symptoms and demonstrated measurable increases in cardiac workload compared to those who slept on their left. The researchers attributed this to the shift in ventricular geometry and the compression of the inferior vena cava, the large vein that returns blood from the lower body back to the heart. When the inferior vena cava is partially compressed by positional pressure, venous return drops. The heart works harder to maintain output. Blood pressure compensates. And across the cerebrovascular system, the network of arteries and veins supplying your brain, pressure dynamics shift in ways that, over time, increase the risk of the one event most people over 60 fear more than almost anything else: stroke. Now let's go deeper, because the stroke connection is not just about pressure, it is about flow, geometry, and a specific vulnerability that develops in the arteries of the neck after the age of 55. Your carotid arteries run along both sides of your neck. They are the primary highways delivering oxygenated blood to your brain. As you age, these arteries accumulate atherosclerotic plaque, a process that begins silently, produces no pain, and often goes undetected until a piece of that plaque breaks free, travels upstream, and blocks a cerebral vessel. When you sleep on your right side, you alter the hemodynamic environment of the right carotid artery in a specific way. The angle of the neck, the weight of the head, and the sustained lateral compression create conditions of reduced and turbulent flow at the carotid bifurcation, the point where the artery splits into internal and external branches. Turbulent flow at this bifurcation is one of the primary mechanical drivers of plaque instability. Research published in the American Journal of Cardiology identified that adults over 55 with moderate carotid stenosis, arterial narrowing that most people carry without knowing it, who habitually slept on the right side, showed measurably higher rates of transient ischemic attacks, sometimes called mini-strokes, compared to left-side sleepers. The difference was not small, it was clinically significant. And here is the part that stops most people when I explain it in a clinical setting. Most strokes do not happen during the day, during exertion, stress, or physical effort. They happen in the early morning hours, between 2 and 8 a.m. when the body is horizontal, when blood pressure follows its natural overnight curve, when a carotid artery has been under 7 hours of positional pressure, and the plaque inside it has been subjected to 7 hours of altered, turbulent flow. You've been sleeping the same way your whole life. No one ever told you it had consequences. It does. There is also a second risk that connects directly to sleep positioning, and most physicians never mention it in the same conversation. Acid reflux, specifically nocturnal acid reflux, the kind that happens silently while you sleep, causes microaspiration into the airway, chronically disrupts sleep architecture, and through the mechanism of vagal nerve stimulation, creates measurable disturbances in cardiac rhythm. Studies have documented a link between chronic nocturnal reflux and increased episodes of atrial fibrillation. And atrial fibrillation, as many people in this audience already know, is one of the most powerful independent risk factors for stroke that exists. Sleeping on the left side significantly reduces nocturnal acid reflux. The anatomy is direct. The stomach's cardiac sphincter sits higher relative to the gastric contents when you are on your left side, reducing the likelihood of acid migrating upward into the esophagus during sleep. Right side sleeping does the opposite. It opens the path. So when you sleep on your right side habitually, you are not managing one risk. You are managing two, simultaneously and silently, every night. Has your doctor ever explained this connection to you? Write never or yes in the comments right now. Your answer matters more than you think. Stay with me, because what I'm about to give you addresses all of this. And it starts tonight. Here is exactly what I want you to do, starting tonight. What I'm about to give you is not a general recommendation. It is not try to sleep on your left side. It is a 4-step repositioning system built around the specific cardiovascular and cerebrovascular mechanisms we just covered that you can implement in your bedroom tonight without buying a single thing, without a prescription, and without a follow-up appointment. I call it the left side sleep protocol. 4 steps. Each one has a reason. Each one has a timing. And together, they address every layer of risk we've discussed: cardiac workload, carotid flow, glymphatic drainage, and nocturnal reflux simultaneously. Step 1, the anchor position. What to do. Before you lie down tonight, place a firm pillow, not a decorative one, a firm one, directly behind your back, not under your head, behind your back at the level of your shoulder blades. Why it works. The single biggest reason people who intend to sleep on their left side wake up on their right is positional drift. During sleep, your body naturally rolls toward its habitual side, the side it has defaulted to for years or decades. Muscle memory, mattress compression, and the body's own gravitational pull work against your conscious intention the moment you lose consciousness. The anchor pillow creates a passive physical barrier. It does not restrain you. It simply raises the mechanical cost of rolling right enough that your sleeping body stays left without any conscious effort required. Research on positional therapy for sleep apnea, published in the Journal of Clinical Sleep Medicine, confirmed that passive posterior anchoring reduced unwanted position shifts by over 60% across a full night of sleep, without waking the sleeper. Timing. Place the pillow before you get into bed. Make it part of your pre-sleep routine, as automatic as brushing your teeth. Step 2. The neck alignment check. What to do. When you are on your left side, your pillow height must keep your head in neutral alignment with your spine, not tilted up, not dropped down. Your ear should be level with your shoulder. If it is not, add or remove pillow height until it is. A rolled towel inside your pillowcase can fine-tune this if your pillow is too flat. Why it works. This step directly addresses carotid hemodynamics. When your neck is in lateral flexion, tilted at an angle because your pillow is too high or too low, the carotid artery on the lower side experiences compression and the one on the upper side experiences stretch. Both conditions alter flow dynamics at the bifurcation. Neutral alignment keeps both carotid arteries in the geometry closest to their upright daytime state, maintaining smooth, laminar flow rather than the turbulent, plaque destabilizing flow we discussed. This is not a comfort recommendation. It is a vascular one. Your neck angle during sleep is a cardiovascular variable. Treat it as one. Timing. Check your alignment when you first lie down and again if you wake during the night and reposition. 30 seconds, every time. Step 3. The elevation adjustment. What to do. Raise the head of your bed or elevate your mattress at the head end by approximately 4 inches. You can use bed risers, which cost under $15 at any hardware store, or place a firm wedge pillow under the top portion of your mattress. The goal is a gentle, whole-body incline, not a steep angle, not a stack of pillows under your head alone. Why it works. This step targets the reflux to arrhythmia pathway. A 4-inch head elevation has been shown in multiple gastroenterology studies, including research published in the American Journal of Gastroenterology, to reduce nocturnal acid exposure in the esophagus by up to 70%. When acid stays in the stomach where it belongs, the vagal nerve stimulation that disrupts cardiac rhythm is eliminated. Atrial fibrillation episodes that cluster in overnight hours, the kind most closely linked to stroke risk, are directly connected to this mechanism in a measurable percentage of patients. Elevation breaks that chain at its root, and unlike medication, it has no side effects, no interactions, and no cost beyond a one-time $15 purchase. Timing. This is a permanent adjustment to your sleep setup, not a nightly decision. Set it once, leave it. Step 4. The pre-sleep hydration window. What to do? Drink 8 ounces of water, 1 full glass, exactly 30 to 45 minutes before you intend to sleep. Not immediately before lying down. 30 to 45 minutes before? Then stop fluid intake for the night. Why it works. Blood viscosity, the thickness of your blood, increases during sleep as the body undergoes mild physiological dehydration through respiration and skin moisture loss. Thicker blood moves more slowly through narrowed vessels. In a carotid artery already carrying atherosclerotic plaque, reduced flow velocity during the overnight hours is one of the conditions most associated with clot formation and thromboembolic stroke. Adequate pre-sleep hydration keeps blood viscosity in a safer range through the critical early morning window, the 2 to 8 a.m. period when stroke incidence peaks. The 30 to 45 minute timing matters because it allows the fluid to be absorbed into circulation before sleep begins, rather than sitting in the bladder and disrupting sleep with a middle of the night waking. You get the vascular benefit without the interruption. Timing. Every night, 30 to 45 minutes before sleep, 8 ounces. No more, no less. That is the left side sleep protocol. 4 steps, 1 pillow behind your back, neutral neck alignment, a 4-inch head elevation. 8 ounces of water 45 minutes before bed. You can implement every single one of these tonight. None of them require a prescription. None of them require a gym. None of them cost more than the price of a pair of bed risers. And 3 of the 4 steps cost nothing at all. What they require is that you understand why your body responds the way it does, and that you now do. That changes what tonight looks like, and every night after it. You came into this video tonight not knowing that the side of your body you sleep on is a cardiovascular variable. You are leaving with the science behind why it matters. The cardiac geometry, the carotid hemodynamics, the glymphatic system, the reflux to arrhythmia pathway, and a 4-step protocol you can begin the moment you walk into your bedroom tonight. That costs you 20 minutes. Use them. The most dangerous thing about stroke risk after 60 is not that the science doesn't exist. It is that the science exists and never reaches the people who need it. Not in a 10-minute appointment, not on a prescription pad, not in a follow-up that never got scheduled. It reaches you here, tonight. Before the morning, it would have mattered most. There is someone in your life, a spouse, a sibling, a parent, a friend, who is sleeping on the wrong side tonight and has no idea what that means for their heart and their brain. This video can find them before it matters. Share it with them, not for this channel. Because the 20 minutes it takes to watch this is 20 minutes that could change what they wake up to tomorrow. If you haven't subscribed yet, please do that now. Every week, I bring you honest, research-based information about what your body needs after 60. The information I wish every patient had before they ended up sitting across from me. Subscribe so you don't miss what's coming next. Everything I've shared today is based on published research and more than 2 decades of clinical experience. It is not a substitute for your personal medical care. Your history is unique. Your medications, your existing conditions, your individual anatomy. Before making any changes to your sleep setup, your daily routine, or anything else we've discussed, please speak with your own doctor first. Bring this information into that conversation. That is exactly where good medicine begins.